Your health care. Have you ever felt your heart racing for no reason while sitting quietly in your favorite chair? Or maybe you stood up too quickly and suddenly the whole room spun a little too long. At first, these may seem like small, harmless moments, but sometimes they are not just coincidences. They are gentle whispers from your heart, quietly asking for help. Heart failure doesn't always show up with a dramatic heart attack or an emergency rush to the hospital. In fact, it often begins quietly, hiding behind little signs that are easy to ignore or dismiss. And that is exactly what this video is about, learning how to recognize those early silent clues before they turn into something much more serious. We're not diving into complicated medical terms or frightening statistics today. Instead, imagine this as a calm, honest conversation, just you and me, talking about what your body may be trying to tell you. Because when it comes to your heart, ignoring the little signals can lead to very big consequences. If you're ready to really listen to what your heart may be saying, type 1 in the comments. If you're not ready just yet, simply press 0. And don't forget to subscribe to Smart Health 365 so you never miss important tips about your health and well-being. Now, let's take a closer look at the very first sign, one that often flies under the radar. When your heart gets tired, it doesn't always cry out with chest pain. Sometimes it simply speeds up, almost like a worker rushing to catch up on lost time. That's why a fast resting heart rate can be one of the very first signs of heart failure. Normally, when you are calm, sitting, resting, or even lying down, your heart should beat steadily at about 60 to 100 beats per minute. But when the heart is weak, it has to work harder to push blood through the body, even when you're doing absolutely nothing. This is when you may feel your heart pounding in your chest, fluttering suddenly, or racing without reason. Some people describe it as a thump-thump that catches them off guard, even while reading a book or watching TV. And this isn't just a one-time sensation. Over time, this extra effort actually wears the heart out even more. According to the American Heart Association, a consistently high resting heart rate has been linked to earlier onset of heart failure and an increased risk of serious complications. So, if this sounds familiar to you, don't ignore it. Keep a simple log of your heart rate, especially when you're at rest. You don't need fancy tools. A basic wrist monitor or even many modern smartphones can do the job. If you notice that your resting rate is regularly above 100 beats per minute, it's time to bring it up with your doctor. That small step could make a very big difference. The next early sign is something many people mistake for normal aging or simple tiredness. Have you ever walked into a room and completely forgotten why you went there? Or maybe you've struggled to follow a conversation or found it hard to stay focused while reading the newspaper. Most people shrug it off as just aging, but sometimes it's actually your heart sending signals through your brain. Here's why. When the heart pumps poorly, less oxygen-rich blood reaches the brain, and the brain needs a constant, steady supply to function at its best. Without it, you may begin to feel mentally foggy, forgetful, or distracted. This isn't just absent-mindedness. It can be an early warning sign. In fact, research published in the Journal of the American College of Cardiology shows that even in early stages, heart failure can bring subtle cognitive decline. Everyday lapses, losing your keys, struggling to focus, forgetting simple things, can actually reflect reduced blood flow to the brain. If this resonates with you, try to track when it happens. Does it occur after climbing stairs? Later in the evening? After physical activity? These patterns can help doctors identify whether the issue is truly heart-related. This isn't meant to scare you. It's about catching things early when you still have the power to protect both your memory and your heart. Another early warning often shows up not in your chest, but in your legs. By the end of the day, have you noticed your socks leaving deep marks on your ankles? Or maybe your shoes feel tighter in the evening, even though they fit perfectly fine in the morning. That swelling in your feet, ankles, or lower legs is another early sign your heart might be struggling. Here's what happens. When the heart can't pump effectively, blood begins to back up in the veins, pushing fluid into the surrounding tissues. That's why swelling usually appears in both legs and tends to worsen as the day goes on. Doctors call this peripheral edema, and it's more than just tired feet. It's often one of the earliest red flags for heart failure. The National Heart, Lung, and Blood Institute notes that fluid buildup in the lower body is a warning that the heart is under strain. Here's a simple home test you can try. Press your thumb against your shin for a few seconds. If a dent stays there instead of bouncing back quickly, mention it to your doctor. New or worsening swelling, especially when it's combined with weight gain or shortness of breath, should never be ignored. Your legs may actually be telling the story of what's happening inside your chest, and listening to that story early can make all the difference. That's why even small tasks can leave you feeling exhausted, as if you've just run a mile. And this isn't about being out of shape. Research from the Journal of the American Medical Association shows that breathlessness with only mild exertion often appears years before a formal diagnosis of heart failure. Many people dismiss it, thinking they're just getting older or slowing down. But in reality, it's the body sending an alarm, a clear signal that something deeper may be going on. If this sounds familiar, start paying attention to patterns. Do you notice it while carrying groceries, gardening, climbing a flight of stairs, or even simply talking while walking? Keeping track of when it happens helps your doctor see the bigger picture. One helpful step is pacing yourself. Take short breaks, move a little more slowly, and don't push through heavy fatigue. But most importantly, don't ignore it. What feels like a small nuisance today could actually be your heart asking for help. Next, let's look at a warning that often shows up when you lie down at night: the struggle to breathe comfortably without extra pillows. Have you ever tried lying flat in bed only to suddenly feel like you couldn't catch your breath? Many people with early heart failure notice that they need extra pillows just to sleep through the night. Some even end up sleeping upright in a chair because it's the only way they can breathe without struggling. This isn't simple snoring, and it's not just age. It's a condition called orthopnea. Here's what's happening. When you lie flat, fluid in your body shifts upward and places pressure on your lungs. A weaker heart can't handle that extra load, and the result is a heavy, suffocating feeling that can rob you of rest. Studies from the New England Journal of Medicine show that orthopnea is a strong predictor of heart failure progression, often appearing long before other classic symptoms. You can even test this yourself by noting how many pillows you use at night. If you consistently need 2 or 3, or if you can only sleep while sitting up, that's a sign worth sharing with your doctor. Now, let's look at another signal that can sneak up quickly: sudden weight gain that isn't from food at all, but from hidden fluid buildup. Have you ever stepped on the scale and noticed you've gained 2 or 3 pounds almost overnight, even though you didn't change your eating habits? Rapid weight gain like this is often caused not by food, but by fluid collecting in the body, one of the classic early signs of heart failure. When the heart isn't pumping effectively, the kidneys hold on to salt and water, leading to fluid retention. This extra fluid doesn't just make the numbers on the scale rise. It can also cause swelling in your belly, your ankles, and even make breathing more difficult. According to the American Heart Association, a sudden gain of more than 2 to 3 pounds in a single day, or more than 5 pounds in a week, is a serious warning signal that your heart needs attention. That's why many doctors recommend weighing yourself at the same time every morning. It's one of the simplest and most powerful tools to catch changes before they become dangerous. If your weight jumps suddenly, don't ignore it. Call your healthcare provider. Keeping a small journal of your daily weight can make all the difference. A few pounds may not seem like much, but when it comes to heart health, those pounds could be your body's way of shouting for help. Next, let's talk about a sign that often shows up in your stomach: feeling full, bloated, or even losing your appetite. Have you noticed feeling full after just a few bites, or struggling with bloating that doesn't seem tied to what you ate? This uncomfortable heaviness in the belly can be another early sign of heart failure. When the heart weakens, fluid can build up in the abdomen, a condition called ascites. It puts pressure on your stomach and liver, making you feel stuffed even when you haven't eaten much. Many people mistake this for indigestion, gas, or just a sluggish stomach. But in reality, it's the heart struggling to keep blood flowing smoothly. The National Heart, Lung, and Blood Institute notes that abdominal swelling and loss of appetite are common in patients with early heart failure. If you're noticing this, pay attention to whether your waistband feels tighter at night or if you lose interest in meals you used to enjoy. Keeping a food and symptom diary can be very helpful for your doctor. And remember, this isn't just about comfort. If your body can't take in enough nutrition, it weakens even more. Protecting your appetite means protecting your strength. Next, let's look at another overlooked signal: developing a nagging cough or wheeze, especially when lying down. Have you ever gone to bed only to be kept awake by a dry, persistent cough that just won't quit? For many people with early heart failure, this cough is worse at night when lying flat. Some even describe a wheezing sound, almost like asthma, except inhalers don't bring relief. What's happening is that fluid begins to back up into the lungs when the heart isn't pumping strongly. That extra fluid irritates the airways and makes breathing more difficult. Research from the American Journal of Respiratory and Critical Care Medicine shows that this type of nighttime cough is a common warning sign of fluid overload linked to heart problems. If you've noticed coughing that doesn't improve with cold medicine or allergy treatments, pay close attention to when it happens. Does it get worse when you lie down? Do you sleep better propped up? These details matter. Sleeping with your head slightly elevated may help ease the symptom, but remember, that only masks the problem. The real solution is getting your heart evaluated. Now let's talk about another unusual sign: struggling to breathe comfortably when simply bending forward, like when tying your shoes. Have you ever bent down to pick something up and suddenly felt out of breath within seconds? This surprising symptom even has a name: bendopnea. It's not about being out of shape. It's a direct signal that your heart is struggling to handle pressure changes when you lean forward. When you bend, blood shifts toward your chest. In a healthy heart, this is no problem. But with heart failure, that added pressure makes it harder for blood to move through the lungs, leading to quick breathlessness. A study in the Journal of the American College of Cardiology found that many patients with heart failure experienced bendopnea within just 30 seconds of leaning forward. If this happens to you, pay attention. It may show up while tying shoes, gardening, or even reaching into a low cupboard. Keep track of how quickly it occurs and how long it takes to ease once you sit upright again. It might feel like a small inconvenience, but in reality, it's a powerful early clue that your heart is under stress. Now, let's move to one of the most common and exhausting warnings: persistent fatigue that lingers no matter how much rest you get. Do you feel tired all the time, even after a full night's sleep? Many people with early heart failure describe a deep fatigue that just doesn't go away. It's not simply about getting older. It's your body signaling that the heart isn't pumping enough oxygen-rich blood to supply your muscles and organs. This constant lack of energy makes everyday tasks harder. Simple things like folding laundry, carrying groceries, or even taking a shower can leave you drained. Studies in the Circulation Journal confirm that reduced exercise tolerance and chronic fatigue are among the earliest and most disabling symptoms of heart failure. Unlike normal tiredness, this exhaustion lingers. You may notice you can't walk as far as you used to, or that you need more breaks during the day. It often sneaks up slowly, making it easy to dismiss until it becomes overwhelming. If you're experiencing this, listen to your body. Keep track of how often you feel worn out and note what activities trigger it. Share these observations with your doctor. They can reveal important patterns. Your strength and energy are vital for independence, and noticing these changes early can truly make a difference. So now you've seen how heart failure often begins with small, quiet signs: A racing pulse, swollen ankles, restless nights, or even just feeling more tired than usual. These signals may be easy to brush off, but they are your body's way of asking for attention. The good news is that catching them early can change the outcome completely. With the right care, lifestyle changes, and support, many people continue to live long, full, independent lives. Your heart is worth listening to. It has carried you through every moment of your life, and it deserves care in return. If this video spoke to you, share it with a friend, and let's spread awareness together. And don't forget to subscribe to Smart Health 365, where we'll keep bringing you simple, heartfelt guidance for a healthier life.